everyone, welcome back to my channel. It's Stephanie here, and I'm about to start another shift in the hospital. Today I'll be working in the emergency department as the internal medicine doctor on call. So I'm sure we're going to see many exciting patients, and I thought I'd take you along today. I actually have to put my mask on before I even head into the hospital. Alright, my mask is on. It's already getting hot in here because it's very hot now in Canada, but now ready to go into the hospital. Hey guys, so it's a little while later. I'm just in the computer room writing down my notes and taking a little break. I've seen a couple of patients already. I got a few consults. I'm going to carefully remove my mask, wash my hands, and then I'll tell you a little bit about what's been going on. Hey guys, so I'm now back in my little office room. I've already seen a few consults already, and before we get into them, I just want to say one thing I love about internal medicine, especially if any of you are interested in internal medicine, is that you see a wide variety of cases. Some things you see that you've seen all the time in what we call our bread and butter cases, and other things are a little more rare, and one thing with internal medicine, you're always learning something new. One of the cases that I want to discuss is actually something that we do see a lot of, but I think it's going to become a lot more prevalent, especially in the next few months. So I had a 72-year-old gentleman referred for an elevated creatinine. Creatinine is a molecule that is metabolized from creatine, which is secreted from your muscles, and it is the molecule that we monitor and look at as a way of measuring kidney function. So a normal creatinine is usually between 60 and 100. Mind you, a low creatinine is rarely ever abnormal. It may be low due to low muscle mass, but you'd rather have your creatinine low than high. And a high creatinine usually is over 100, but that also depends on the lab that you're going to and the hospital that you're at. So he came in with an elevated creatinine, and we would call this acute kidney injury, or an AKI. So I asked the patient a few questions, and this was his story. He had a 3-day history of vomiting, he had a little bit of diarrhea, and he was feeling weak and tired. And those were his main symptoms, just feeling generally unwell, or what we call a general malaise. He never had a fever, he didn't have any respiratory tract symptoms, he hasn't been exposed to anyone with coronavirus, so we kind of ruled that out, and although they can have GI symptoms, it is a lower likelihood on my differential of what has actually caused his elevated creatinine. The other thing that I found on his examination was that his heart rate was a little bit high. It was about approximately 110 beats per minute, and the normal heart rate is between 60 and 100. The other thing was that his blood pressure was a little bit soft or a little bit low, so it was 100 over 60, which for this gentleman who takes high blood pressure medications is low for him. So with this information, there's a few key points that you can get to steer you in the right direction of what is causing his elevated creatinine. The first is the fact that he's been vomiting and having diarrhea. So he's been losing a lot of fluid and probably not replenishing it as much as he could be. So replenishing it in the sense of making sure you take in enough fluids, take in enough water to help counteract the losses that you're experiencing from the vomiting and the diarrhea. The other important factor is that he's having exam findings such as an elevated heart rate and a low blood pressure that could lead me to the fact that because of his loss of fluids that he is quite dehydrated. And it's likely the dehydration that's causing him to feel this unwell, as well as causing his creatinine to become elevated and his kidneys to not work as well. When you look at acute kidney injury, you can divide this into pre-renal, renal, and post-renal. Pre-renal means that the kidneys are not sensing enough fluid, dehydration can be a cause, or the fluid can be elsewhere in the body, and therefore it's going to cause that creatinine level to jump up. If it's a renal problem, it could be something that's happening within the kidney itself. It could be inflammation, it could be infection, an autoimmune disorder that's affecting the kidney. It could be from medication as well. And if it's a post-renal problem, there could be some type of obstruction that's preventing the kidney from doing its job. So with this gentleman, I am doing a few things for him. He is elderly and he has had this vomiting and diarrhea, so I am going to admit him to the hospital. It's likely just from dehydration that his kidney level has gone up. but I'm going to make sure that we monitor his urine function so that we're monitoring his urine output throughout the night. We're also going to monitor his creatinine level to make sure that it is improving during his time in hospital, and it should be normalizing as he's given fluids. So that's the next thing that I'm going to do. I'm going to give this patient IV fluids so that he can rehydrate, and then we'll see how that affects the kidney level. And then finally, I'm going to stop some of his medications, because sometimes blood pressure medications can affect the kidneys, sometimes some diabetes medications can affect the kidneys. Therefore, whenever someone's having an acute kidney injury episode, we will stop those nephrotoxic medications until the kidneys have repaired themselves and until the creatinine has normalized. Alright guys, so this is a little information about acute kidney injury caused by a pre-renal cause, and that's dehydration. So always stay hydrated, especially when it's hot outside, or if you're having any volume losses such as vomiting or diarrhea. Always make sure you try and improve your fluid intake, whether that's with water or with Gatorade that has other electrolytes in it to help replenish the electrolytes that are lost. That is an important tip for you guys to take and help prevent any kidney issues with the hot weather. So now it's time to dictate on my patients. Like I think I've said in some other videos, we do a lot of dictating, especially after we admit a patient, and that will provide a formal consult note. So a note that includes the problem that the patient came in with, as well as everything that was done in hospital that can be sent to the family doctor and any other relevant parties who were also involved in this patient's care. And that just keeps good documentation so that if this patient comes in again with another health problem, we'll have their previous visit on file. Hello? Hi, yes, this is the internist on call. Is he short of breath? Okay. And what was his creatinine? Over 200, okay. Okay, I'll be down to see him. Thanks. So I just got a phone call from the Emerge staff, and it sounds like there's another patient in Emerge, a 50-year-old gentleman who's coming in with some shortness of breath, as well as also an acute kidney injury. His creatinine is actually over 200, which is quite significantly elevated. But from the story, it sounds like this is likely from a different cause of kidney failure. So different from the patient we discussed earlier with dehydration. So I'm going to go down and see that patient, and then we'll discuss his case as soon as I hear his story and examine him. Okay guys, so I just got back from seeing that patient, and what's interesting is he has an elevated creatinine, but for a completely different reason, like I said earlier. This is a gentleman who has congestive heart failure. So sometimes when your heart is not pumping very well, it can't pump the blood throughout the body, and sometimes the fluid, because there's so much accumulating, gets out of the vessels and into different areas. So you may notice that they have trouble breathing because the fluid is entering their lungs, or they have very swollen legs because the fluid is going into their veins and into the leg area and kind of going to the dependent regions, which is when you're standing, your legs, because they're closest to the ground. So the fluid is going everywhere else except towards the kidneys, and that can cause the kidneys to feel that they are dehydrated even when they're not. That will also cause the creatinine level, or the measure of kidney function, to go up. And that's exactly what happened with this gentleman. To help treat this patient, it's a bit of a different treatment than the previous patient I discussed. So what you actually want to do is give him medication to help remove that fluid. Basically, something called a diuretic, or Lasix, which helps remove the fluid from areas of the body and helps push it towards the kidneys. This will hopefully help improve his kidney function. And so that's what I'm doing with this patient. He has a lot of other medical issues as well that need to be addressed, but I think today's little important piece of information is all about kidneys and how they're so important at any age. Never take your kidneys for granted. Alright guys, so I just finished admitting that patient, and it looks like we don't have any consults pending right now, so that's great. I'm gonna get a little bite to eat because that's what I love to do when I have some time on my hands, and then I'm also gonna make sure that I don't have any paperwork pending, because again, that's another part of medicine that you want to make sure is all done before you leave for the day, and then you won't have anything hanging over your head. it's home time.
All right, and that is another shift and a day in the life of an internal medicine doctor. What I love about vlogging and what I love about my YouTube channel is that I really want you to be able to learn something to help improve your own health, as well as see what I do in my own life as a doctor. So click that subscribe button to follow along, as well as ring the bell so you never miss a video and get notified of my next video. Everyone, stay healthy, be happy. See you later.